the maternity ward, and we just discharged 2 in the female ward. Each of the ward is equipped with about 20 beds for our patients. We have been receiving patients since January this year, and the hospital is fully operational. Thank you so much, ladies and gentlemen.
As you might have heard yesterday during your reception, the KEBBI state government in its quest to bring healthcare delivery system to the doorsteps of its citizens, this administration has constructed 14 general hospitals across the states. In fact, we have a functional general hospital in every of the local government headquarters. In some of the local governments, because of their size, could boost up to 3 general hospitals. Something like Donko Sagu. We have a general hospital in Riba, which we are going to go and see. We have another one in Bena, and also one in Wasago. They are all within one local government. Something like when we get back to Bagodo side, we have 30 general hospitals.
Address the facilities that you have here. Address what are the facilities that you have here.
As you have heard from the doctor in charge of the hospital, this hospital is fully functional now. The PMO has enumerated virtually all the facilities we have in this general hospital. We have all the wards that are required for a general hospital. We are the hospital is fully equipped. You can see the surplus of equipments and the furniture that is in place. Virtually all our hospitals, all the new general hospitals in the state have passed surplus equipments and the materials in stock. Yes, Honorable.
I am sure there is an X-ray machine in one of the cartons. Is it cartons or crates? Because of the lead lining. That is why it is not installed. For every X-ray machine, there must be lead lining, so that the ultraviolet, ultraviolet radiation will not go out of the building. And this is why I'm sure that crate is waiting for installation. But including the, what do they call this equipment for seeing the pregnant woman, ultrasound and other things, there is no hospital that will not have it. We intend to install the latest equipment in all the hospitals. You don't need to move from here to Zuru. Thank you.
A bit curious about the level of professional doctors we have stationed in the hospital, because what we notice from our experience of going around the country, that some doctors shuttle. They will be in that hospital, and when there's an emergency, they run to this hospital. So what is the level of preparedness of this hospital, sir?
In every hospital, we have at least more than a doctor stationed there, permanently stationed in the hospital. Depends on the hospitals. Something like this hospital has just started operation January. So we are doing everything possible to get more doctors into the hospital.
With AIT. I'm just concerned about what you earlier said, that you have enough equipment, you even have surplus. My question is, why do we have surplus in a situation whereby we have other things to do with money, for instance? Why should we have surplus?
I think in every situation, what we have done for every new hospital, like if it is 50-bed hospital, we brought in 60, so that if there is a breakdown of anything, we can replace it without any going anywhere or asking for any red tape or bureaucratic go-slow. We need to have everything around so that the doctor can easily replace anything he wants. next time I will have, and definitely some of these things that I've seen, I will remove them and replace them. This one is not a problem.
Cash, they have cash in place, monthly.
State is enjoying 400,000 naira on monthly running cost, besides the salaries and what have you. So if you find a sagging or ceiling or something, maybe the PMO there has not really noticed that, but he has enough funds to take care of all those things.
In facilities like this, usually the level of productivity of the personnel is contingent upon the welfare package that is made for them. Now, will you tell us, Commissioner, whether you've made provisioning for accommodation for the doctor and the nurses, and if so, what other additional facilities have you put in place to make them more comfortable, so that they will be close by to attend to whatever emergency that may arise? Will you please respond to that?
Built at least 6 functional houses for the doctor, the doctors, nurses, and what have you. So there is no accommodation problem here.
So in short, we have staff quarters for every general hospital.
There are staff quarters for every general
Go
hospital.
outside, you see their quarters there.
Yes.
Go outside, you see their quarters.
She representing the National Council of Women Society. Honorable Commissioner for Health, you have just told us that we have every doctor here in place. And I know Mr. President, in his education health sector, want to provide the health facilities affordable to his citizens, especially as regards to Nigerian women. Please, I want to ask you, you have 3 patients there in the maternity sector. Please do have a good gynecologist for the women. Thank you.
Well, this one.
Thank you. Every doctor has been trained to handle emergency in obstetric, and not only obstetric and gynecology, but every aspect of medicine, at least the basics, to be able to save life. Every doctor has that skill.
Please, can they do the cesarean operation when it is necessary?
Why not? They can.
They can or you can.
I can.
Please give it to Commissioner. Give it to Commissioner.
The good side of it is that this administration has provided a budgetary line of 500 million naira annually for pregnant women and children under 5 free treatment. Not only that, we also partake from the national midwifery scheme. I think as we go along, you may likely come across our MDG's clinics that are being manned by midwives sent from Abuja. Not only that, the good thing is that Zuru is just a stone's throw from here, where we have an old hospital where you have all the specialties you require. So in the event of an emergency that he cannot cope, within 15 minutes he's in Zuru, and all these hospitals are provided with ambulances, mortuary vehicles, and call duty vehicles. Thank you.
Are you people capable of attending to all the needs of the people without challenges? And everything you need working properly that provided for in this hospital? Very good.
For the main ward. Secure ward. Okay. Now, please.